Hey guys, Dr. Andy here. Today I want to talk about something that is brought up all of the time in my office, and believe it or not, I actually suffer from it as well, and that is popping and clicking inside the shoulder. So anytime that I can tell like my back is getting tight, I actually tend to get more clicking going on in my shoulder than normal. It's usually my left one, but I can't tell you how often my patients come in and tell me how much clicking and popping that they hear, and they're always like, "Hey doc, listen to this, listen to my shoulder, it's popping, I'm popping like all the time." I'm like, yes, I understand. Completely normal. Okay, not normal in that it's good for you, normal in that we hear it all the time. So many of my patients complain of it. So to start off, let's talk about what that is. The primary culprit of popping and clicking in the shoulder is shoulder instability, meaning that the shoulder joint is actually moving around a little too much, and as a result, or it's not sitting exactly where it's supposed to be in that ball and socket joint. So as a result, all of that extra movement is moving around the ligaments and the tendons that are controlling that ball and socket joint a little too much. Maybe, and the metaphor I kind of use for it, the pop that you hear or feel is almost like a piece of tendon or ligament kind of rolling over a bone and clicking it or thrumming it kind of like a guitar string, okay? So all of that extra popping and clicking that you hear in the shoulder is typically caused by shoulder instability. So is the popping or the clicking bad? By itself, no. Like, just because your body makes noise doesn't mean that it's bad. We actually have a name for it in the medical world. It's called crepitus, okay? Crepitus, just a fancy word literally for sounds that the body make that's not necessarily bad, it just means something else, right? So is the popping and clicking bad? No, the popping is not clicking. But of course, if the main culprit is shoulder instability doesn't necessarily cause your pain, but it absolutely can result in you getting injured, which causes a more severe problem. So all the time we're getting shoulder complaints, patients coming in with shoulder issues, they got tons of popping. Am I treating the popping and the clicking in the shoulder? No, I'm not. I'm actually treating the shoulder instability that's causing their pain and causing that clicking, right? So the cool thing is that we can actually release some of that. We can get it to start to decrease, and we don't hear it as much. We've done it with myself. I've been doing a lot more rehab on my shoulder lately just to kind of strengthen it up. I heard it a couple months back, but we're going to work on the stability of that shoulder, make sure that we're having the joint sit properly. If we got to treat any of the muscles that are in there that are too tight, we're going to loosen them up. If they're too loose, we're going to tighten them or we're going to strengthen them. That's how we fix shoulder stability, okay? So is popping and clicking in the shoulder bad? No, but it does mean something that should be addressed, all right? So hopefully you found this information useful. Always remember to send the video to a friend if you like it, and always remember to live with passion, not pain.